Ghana is going through a fast digital transformation that is changing how people get information and services. Government efforts like a national broadband strategy and improved internet access have helped push this shift. The COVID-19 pandemic sped up this change and led Ghana to revise its e-health strategy in 2023. Health providers and users increasingly rely on digital platforms. Despite the progress, access is still unequal. Because of this digital divide, the cost of phones and data, low digital literacy in rural areas, and gender gaps. When more women and men lack smartphones, limits who can benefit from language, disability, social factors, and all can also shape whether people can truly access and use digital health technologies in Ghana. Welcome to Let's Talk Digital podcast, where we explore critical issues shaping our world today. I'm your host, Sandra Adley, and today we are diving into the topic that affects us all: digital transformation in Ghana and what it means for access to health. Ghana is rapidly going digital, from mobile phones to online health services. Technology is changing how we work, live, and even seek healthcare. But the big question is everyone benefiting equally? To help us unpack this, I'm joined by my colleagues
Solomon Achubia.
I'm Martina Menukwe.
Rahel Enshi.
and myself, who work closely on digital health and rights in Ghana. Welcome to the show.
Thank you.
Let's start with the big picture. Ghana is clearly undergoing a fast-paced digital transformation. What does that really mean in everyday terms? Let me start with you, Solomon.
Yeah, so thank you. So it is true, and it is highly commendable in terms of the pace, and then the rate at which Ghana is, experiencing digital transformation. And then Ghana currently have a number of digital policies, e-health policies, and other digital health policies that has all contributed to the efficacy and the effectiveness of digital health. Yes, so.
All right, thank you, Solomon. How about you, Martin?
So I can talk about how Ghana is increasingly using technology to improve its mode of service delivery. And we can agree that we've moved to a certain stage in life where even students, right after COVID, started using online learning or e-learning. We can also talk about bank transaction. You don't need to travel all the time.
Good.
You can just sit at the comfort of your own and just do it. So that's what I can talk about it.
That's lovely. Yes, Rahel.
Yeah, so I think that's basically like we are doing more online than offline in recent times. And I think that it is something that globally, that's where we all are at. But the effect of COVID-19 has, let's say, accelerated the process for Ghana.
Okay.
So now we are looking for easier and quicker ways to do things, and we're able to do that, leveraging on online. So for instance, back in the days, you probably have to go to the health facility to get some information regarding certain things, but now you can get it online.
Sure.
And now people do consultations online. Back then, you go to the health facility, go and queue till it gets to your turn to see the doctor. But now you can do it through a phone call. You can do it online. Learning is being done there. A lot of lecturers have moved. Up until COVID-19, I didn't think that the average Ghanaian lecturer would be looking at Zoom or Google Meet for, lectures. Because back then, when people used to suggest it, they would say, the first world countries are doing it, why can't we do the same? Then we say that, no, we will not do it. But COVID forced us to employ all of those methods. School children were being taught online. Lecturers were being had online. Hospital consultations were being had online, and we're even looking at ways to actually deliver even medicine without a face-to-face, conversation.
Yeah.
So, it just means that, so in everyday terms, it just means that we are now looking for quicker and easier ways to do things online without a lot of physical interaction. Yeah.
Yeah.
All right.
But then I don't know if it is part of your questions.
Okay.
But then, I mean, learning from my colleagues, I mean, the tangible or the improvement we've seen in, I mean, digital transformation in Ghana, which has led to improvement in access to health information and health services, health education, and other health support programs online. But then we should also bear in mind or note that progress in terms of digital health should not only be measured by infrastructure,
Yeah.
but also by how meaningful participation and then benefit, how communities are able to benefit, access these services, and then meaningfully, I mean, participate in these services. Yeah.
Okay.
All right.
Yeah.
Thank you for your wonderful input. Now, looking at COVID-19 as the turning point, you all will agree with me that COVID-19, about that time, a lot has changed. And where we find ourselves in now, how would you say that the pandemic has influenced digital health in Ghana? Like, really in Ghana? Martin, let's go.
So for me, I think it was a very great shift.
Uh-huh.
At a point, I was even scared. Okay, I was even scared that I was going to lose my job around that time
Okay.
because a lot of jobs or a lot of things were
Being
in
laid
person.
off. Yeah.
Okay.
Sure.
And also, I quite remember during COVID time, I wanted to buy a medication. And that was when I even started using delivery stuff. I also heard over some places that some people were using drone to also buy other stuff to
Zip
just
line.
to have delivery into their homes and other stuff. So it was a very great shift. We also had people even doing online consultation with doctors, and as I mentioned earlier on, we also had people also starting learning, doing online education and other stuff. So for me, it was a very great shift, and was a bit scary at first, but it got normal and it's still normal and we are hoping that it even gets better as we move on.
All right. Thank you, Martin. Yes, Rachel.
Yeah, so I think that in as much as there has been a lot of changes in how we render service due to the advent of technology and all of that, I think that one thing that it made very clear to me is the digital divide it's also exposed.
Perfect. True.
So if you live in an urban area, you think that, oh, this is a quick and easy way to do something, to access information, to get health education and all of that, because I have access to a smartphone, and also because I am able to buy data. So this is easy for me. But then we know that our system or our country is not just, only urban areas.
Yeah.
We have a lot of rural areas. I mean, we do not like to admit it, but it is like, for instance, you ask somebody, oh, where do you come from? Then she says, oh, Kumasi. But you are not from the Kumasi town. It is in a community somewhere in the suburb of Kumasi. That is where you come from.
Yeah.
But so this actually made me realize that even though this shift is happening, even though this change is happening, it is going to broaden the inequalities that exist in our society. So I am able to do that easily, but the same person in a different part of an area would not be able to access health education. What they had was the chipped compound in that community, and COVID has happened. Health workers who are not properly equipped are not able to, come to the health facility. Then what happens to them when they are seeking health care? How do they even figure out that, this is what is wrong with me? Because there is no digital device to use. They do not have access to smartphones like we do in the urban areas.
Yes.
For the people who even have access to smartphones, let's talk about network. Even in the urban areas, we were crying that, today you say, this network is off, tomorrow that network is off. Even fairly recently, we had one of our major networks going off for several hours. So you can imagine persons in these communities that do not have even network in the first place. Then they are getting left behind. Yes, the shift is happening, but then it's only a few that are benefiting. So that's what made me. That's the challenge that I saw with the shift in how our health system was going. Yeah.
Yeah. So
Anything to add?
yeah, I couldn't disagree any less with with Martin and then Rahel. So of course, we all saw how rapidly COVID-19, speed up, Ghana's digital health transformation.
Yeah.
Like Martin mentioned, people could now consult online,
Yeah.
doctors and medical or other health professionals online. People could even use health messaging
Yeah.
for purposes of health services, and people could access health information, all that. But then, like she mentioned, it also exposed the issues of inequalities. Was it everybody in Ghana that was able to consult a doctor online? Was it everybody that was able to
Nah,
use?
not at all.
Yes. So issues of geography, those in the rural areas, young adults, women, and all those in the rural areas couldn't access these online services that those in the cities were. And even those in the cities, even though they may have access, but still people could still not access some of these services due to cost of data.
Yeah.
Data.
Yeah, so there's a little that I had to add that even though COVID-19, sped up the process, but it's also came with its own
It
issues.
came with its own issue.
Is it? Oh, sorry. Isn't it also around that time they took down the zone bundle?
Exactly.
Yes, zone bundle. I haven't heard that in a very long time.
Yeah.
In my zone, for instance, I was going to one in my zone. So when you move out of the
Your
zone,
zone.
you don't get network again.
Yeah, so I think that, it reminded me when you mentioned the high cost of data, that's when I remembered because
Zone
people
bundle.
were struggling.
Yeah.
COVID-19 meant some people were laid off. COVID-19 meant some people were not actively able to, work to earn money.
Yeah.
And then I think for 5 Ghana cedis you used to have some, gigabytes to be able to, hold body for like at least, 72 hours or something like that.
Free night calls as well.
it seems so long ago.
And even the midnight
Yeah, but
bundles
then
too.
that one was also taken off.
Yeah.
So now if people needed to access health information, and which was very critical at that point, if people needed to be abreast with news of what is happening in the health area, because COVID-19 was a big health issue.
Yeah, it was.
High cost of data was preventing people from being able to access that. So yeah, I agree that the high data cost also really caused a wider gap in the inequalities when it comes to the country.
I love the fact that you brought in like the digital device, especially in the rural areas where, like, let's say men are more likely to have smartphones than even women, decreasing their chances of getting access to these digital tools. Now, looking at digital divide, what does that looking like in Ghana's context? What do you think we can do better about that?
So the digital divide in Ghana's context, as I already mentioned, is the fact that accessibility in the urban area is not the same as accessibility in the rural area. There is a vast difference in that. And honestly, I think that we delude ourselves into thinking that the capital cities of the regions are all there is to a region. So like, let's say you come to Greater Accra, you come to Accra, you come to Accra and you think that that is all there is. But even in Accra, there are certain areas where people struggle with network. There are certain areas where people struggle with access to mobile phones. There are some key populations that are not able, due to the inequalities that exist, it affects their earning, economic independence, and they are not able to afford these smartphones that we use in, getting online to access all of these health informations and all of that. So even, let's say, in the event that you have a smartphone as somebody that lives in this country, if you are not financially buoyant, how would you pay for the time of the doctor that you're trying to consult? But we sit here and think that, since, there are some, how do I put it? The shift has happened and we are now able to do a lot of things easily online. We just think that this is just us. So I want to believe that there are more rural areas in Ghana than there are urban areas.
Yeah.
But unfortunately, the urban areas are loud, and it looks like, you know, they are the economic hub of the country. So a lot of things are going on. So we think that, oh, yeah. Like, this is us.
Yeah.
But that is not it. There's a very huge gap. If you work in the development space, you realize a lot of these things, which I do. You go to a particular region, you see the capital, the city, and then after you leave the city, you are not even getting network. And you can tell that the next community is not far from the capital city. It's not far from the capital city, but the network is a challenge. So I think we are not paying a lot of attention to this, but there's really a digital divide in Ghana. The last time I had a conversation about it, somebody was like, oh, and then so be using iPhone. All of you are using iPhone, you are using high-end phones. I don't think there's a digital divide in Ghana. It's because you live in one particular part of the country. You live in the city. Your privilege is that you have access to these things quite easily. Your privilege is that you are financially buoyant. So you think that it is the same for everybody. If we pick 10 people in this country, the well-to-do people will be 2, the middle class will be 1, the rest are suffering. But then the well-to-do people that are 2, they live very flashy lives. So somebody sitting somewhere would think that it covers for all of us. People say that, oh, Accra is so expensive. How are you people surviving? Yeah, but people are here surviving. And the ballers that if you go online and you would see, they are like the 1%. They are like the 1% of the population in the city. But then if you look at it from a bird view, you would think that like everything is rosy for everybody that lives in Accra. Because again, over the weekends, the pubs are full. All the enjoyment places have a lot of people in there, so we think that life is actually easier. But there is, when it comes to accessibility to some of these things, we do not have it. So there's really, really a great digital divide, but we don't see it because the urban places are louder, so we think that it covers for everybody else. Yeah.
So with what she mentioned, what Raya mentioned, I mean, it's not everyone who lives in the urban area who have access to even internet, because I mean it's very costly to even access even buying a phone or something. And also after buying the phone, you need to buy data each and every blessed day. If we can tell the truth to ourselves, there have been times that we hear crime rates really increasing in numbers these days, because if I don't have it, then I have to come to you to steal. And also, I mean, make my life very simple and easy for me. So these are some of the ways, or these are some of the reasons. These are some of what's the word? I want a word like
discrepancies.
Thank you. That has, you see, so it has led people to do certain things that I'm not sure anyone sat down to think about going to steal someone. There have been instances where people were arrested because they took people's phones and other stuff, and they were tracked to, I mean, get those items. And before even get them, they've even sold the whole thing to, you buy a phone worth about 10,000, 5,000, and they'll go and sell it. I mean,
I really hope you are not justifying robbery. Honestly, I really hope you are not justifying robbery.
No, I'm not.
Okay,
I'm not.
Okay,
I'm not. I mean, I'm talking about
yes,
some
because
of
I'm suffering too, but you don't see me robbing people.
I went to buy the phone, you see, and you just come and use like a few minutes, come and say the phone, go and say that 500 cedis. Then what happens? Are you trying to tell me that I should increase more in my robbery?
It's because they want to appear flashy. I mean, that's the thing, no. People want to appear flashy. Not just that, people want to belong. You get it? The fact that I see a friend holding an iPhone, I want to get it. And I mean, it all boils down to digital. It all boils down to what people want to belong to a certain class of society. So that is it. That's also one cause of the digital divide.
It's not as simple as that. The issue of a digital divide is very multi-dimensional. And it includes cost that prevents people from accessing online services and digital health services. It includes issues of language.
Yeah.
What is the language around?
Exactly.
Yes, online
Information.
information. And it even includes issues of literacy.
Yeah.
Yes. So, and then you know it is more pronounced in the remote areas, in the countryside, where in the rural areas where rural youth and then young women and other marginalized communities are not able to access, are not able to, meaningfully participate in the digital transformation that we are talking about. And then I also realized that in your question, you also, the question was in twofold. You also asked what could be done
Yeah.
as part of measures in addressing the issues of digital divide. Of course, from in my view, I think the producers of digital solutions have to be very deliberate in terms of their inclusion.
Yeah.
Yes, so it has to be there has to be inclusivity in the design of so that it serves all people. And then, of course, I think this should even come first. Issues of data, like Martin mentioned. I mean, even in the
cost.
urban areas,
Yeah.
people have access. People have iPhones, like we are all saying, but still
They're not able
are
to-
not able to maximize their access to health information and online services because of cost. And so those are some of them. So if issues around cost of data could also be looked at, those are some ways that we could help at least not eliminate totally the issue of digital divide, but at least minimize the the effects or the impact.
Okay,
Thank
I love the conversation. I love where it's heading to. But it looks like we are leaving some people out. Now, I want us to zoom in on gender. And in my earlier statements, there was a brief highlight that more women than men lack access to smartphones. What does it matter?
Well, so women are part of the population of the country.
Correct.
Women are even more, according to statistics, we have more women in the country than we have men. And to alienate a very major population of the country due to, accessibility, it's a big issue. Women also have health issues, right? They are even more likely to have health issues because of everything that we go through. So the hormonal changes and everything. And I mean, there's conversations around childbirth and all of that. So women are more likely to have like these health issues. But according to the paying the cost of connection, the research, that data was evident that more men had access to devices than women. And so now the big question is, if these women need to access information regarding their health, looking at how much the world has shifted, what then do they do? And this has serious repercussions because then it means that it leaves women more vulnerable. Because then they would have to look at ways by which they can have access to these devices. And in an, a utopian world, it would have, this should be easy because if you live with a man who has a phone, a device that he can use to, access health information, that's fine, you can use it. But we know the world is not ideal like that. Because if it's where we will not be dealing with the staggering numbers we have regarding sexual and gender-based violence. So we know that women are living in a very vulnerable climate. So if women are not able to, access these information, or sometimes the privacy issue even comes in. Maybe they want to access information regarding a health issue, but then they do not want another person to know about it. Then now what do? They keep it to themselves. So this area is one area that I'm very, very passionate about. And again, when we have these conversations, it will still boil back to the, flashy concocted statistics that we have that women have more phones. It's women that they are buying the big phones
But
for.
it's true.
They have
No,
the money.
it's true.
No,
No,
hold on.
For me, I think it's true.
No.
I believe it is true.
Again, you are looking at it through your privileged urban lens.
No.
Yeah.
You are looking at it through your privileged urban lens.
No.
You are in the same class with people who come from affluent homes. We probably know women or ladies that come from affluent homes, or people that the ground for them is soft. We are talking about the urban digital divide here.
Okay.
And since women are less likely to have access to a device, again, we are not talking about your Accra and your fancy school. So don't use do not use the women and the ladies in your fancy school to for everyone to generalize it. It is the ladies and the women that maybe your circle, they are privileged. Yeah. But if you come to the average Ghanaian woman, that is not making six figures, the average Ghanaian woman that is probably likely, not, economically independent. And whether we like it or not, we have more people than the few that are economically independent. So these are the ones that we are looking at. I think that part of our privilege as, certain class of people in this country is to be able to have these conversations devoid of our privilege lenses. When I'm having conversations like this and I say as women, somebody will say, oh no, but then you are educated, but then you have access to this. I know my privilege is that I recognize that I'm a privileged individual based on certain things. No, I did not say that I have money. Tomorrow people bring up this video and you people said I said I'm rich. No,
you do have money. You look like money. Right now you look like money.
But then my privilege is that I am able to acknowledge that I have access to a device.
Yeah.
My privilege is that I am not in a relationship that is, how do I put it, a toxic relationship or a violent relationship. All of these things, we take all of this into account for, the average Ghanaian woman. So these people not being able to get the privacy to access information about their health is truly telling of our system. It says a lot about the product, the health designs that we have. Because maybe a woman may have access to what we call YAM. If these digital health systems were designed in such a way that it had the average woman in mind, then this will not be a problem. So as Solomon mentioned, that the accessibility bit that Solomon mentioned, this brings us back to it. So we're not designing it, we didn't design these digital, systems with the average non-economically independent woman in mind. And that is like a chunk of the population of the country that you are living out. We are leaving more women out. We are not addressing their health needs. We say, oh, we have shifted to the digital system. Ghana is now in the digital age, and then we are leaving certain key populations who are vulnerable out of the conversations. We do not include their needs in the design. We do not include their needs in the accessibility. Aside the fact that these women do not even have access to these devices. Again, if they have access, are these systems designed in such a way that women are able to understand? That is the language barrier Solomon mentioned. And we have a lot of tribes in the country. We have a lot of them. So what do we need to do from the inception stage to be able to carry all of these people along? So yes, there is a digital divide, but then also we have more women who are at a disadvantage when it comes to these digital health systems than men. And that is something that we as people need to sit down and look at and come up with designs that cater to these people.
Yeah, I think Reha has made some very key important points, which I agree with. Martin, I'm not disagreeing with you.
But I didn't say anything.
Yes.
I haven't said anything.
You agree
yet.
with Martin?
No, I agree with you.
Okay.
And I need to hear you say you disagree with Martin.
No,
In a way,
you don't have to.
because he made mention of the fact that women, get
Buying
to
more
use
stuff.
phones that are bought to them by their boyfriends, and all that,
And their husbands.
and their husbands.
Yes.
But then, Rahel was
And
saying.
they are big brothers.
It
not
is-
to cut
it
you
is
short.
wrong.
You
In general-
you know from where I
like-
said to, I could also tell you that I know a lot of men that they bought
Phone for
women
their-
bought phones for.
Yeah.
I don't know about
So
that.
so
We'll send it
Exactly.
out.
So you see, that is our privilege. You know, from where you sit and you are looking at the issue, and from where I sit, we are looking at the same issue, but we are seeing very different things.
yes. yes.
So you see, from where you are sitting, you can see this wood, right?
Yes.
No.
You
No, you
can
can't see.
you
I
you
can't
can- you
see.
you can see
Ryan, I can't see
no you can see
anything.
this
Ryan,
wood.
I can't see
I can
anything.
also see this wood, but from where I sit, I can also see a trash can, but you can't.
Yeah.
So that is it.
Yeah, so I was just
Yeah.
trying to say that some of these comments, I mean, contribute to the issue of gender inequality,
Yes.
especially in terms of access to
That's
health,
helpful.
digital health like we were talking about.
Yeah.
And Rahel actually made a very important point about information. I mean, women having access to information. And most women in the countryside, in the rural areas, are not able to have access to this information because they do not even have access to this digital device. And then you know that you get to realize it's a continuum.
Yeah.
So, you know, having access to information, then you get to have leads to access to opportunities.
Yeah.
And then you are able to participate in these opportunities.
Yeah.
And so if women do not, in the first place, do not have access to this information because of because of them not having access to digital device, how do they get to know about opportunities to even
Yeah.
participate in it?
Yeah.
So I think, like I mentioned earlier on, we should digital solutions, designs and solutions should be very deliberate in terms of inclusion.
Yeah.
And then, like she also mentioned, the issue of language.
Yeah.
And then, as part of that, I also think that solutions should be sort of multilingual in different languages
Yeah.
to be able to, promote more inclusion and then access.
Okay, so I agree with Rahel. Not that I don't agree with her. I do.
You do?
Okay, but I mean, I am not just looking at just women. I am looking at young people.
Okay.
Okay, because not all young people are involved when it comes to digital health. Okay, there are some, especially with the boy child. Okay, some boy child go through a whole lot, and sometimes we are brought up to be known that you're a boy. You don't have to be talking. It's okay. It's okay for a boy to be raped, and you don't have to talk about it. And yet, society has made it look like it's okay. You don't have to voice about it. I'm just shifting from just the boy child to young people as a community. There have been a division of even young people accessing facilities, especially young people living with HIV, are unable to access a full potential health information. Sometimes, in some places, they do have youth corner.
Yeah.
And some places, they don't have youth corners. And you can look at this from both urban and also the rural places. Yet, in some places, in these rural places, young people are still being pushed away, are not even looking upon, because it's even a shame for a young boy or a young girl to even go to the hospital and talk about sex and ask questions related digital health rights. And it's a shame for a mother or a father or a parent to give a child phone and sees the child looking at something that is health beneficial, especially when a child is reading about sex. It's a taboo in our part of the world.
Yeah.
These are some of the things that I think young people are being ignored and not looked upon.
Okay.
Yeah.
Thank you very much. Well, this brings us a very important point on digital health and rights. As in, like, digital access as human rights issue. How should we be thinking about this? Taking from the point you just said, Martin.
The question again.
Looking at digital health and rights, as in digital access as a human rights issue. How should we be thinking about this?
I think there should be a lot of education. First, we need to have
Digital literacy.
digital literacy, and especially the education should be on how people should navigate on online, and should be able to verify when they see anything that isn't is of a threat or things that will lead them into danger or something like that. So I think there should be a digital literacy. They should improve it. There is, but they should improve it. Not every child have access to that.
Yeah.
Some do, some don't do, especially in the rural areas. And I keep saying, even some part of Accra, or some part of Kumasi, or some part of Takrade, or some part of Sunyani do not have this kind of education.
Yeah, I think there is this direct link or relationship between access to digital health tools and human rights, in a sense that access to digital health tools leads to have, some implication on some rights as right to health, right to information, issues of equality, dignity, right to information. So that if people do not have access to digital tools and digital information, or especially if people do not have access to digital tools because of costs, as we earlier mentioned, the other factors, then it directly affects their rights. It means that their right to health, their right to dignity, to equality, to information are all impacted.
Okay.
Anything to add?
Yes, so I just want to add that, so the research that was conducted, the paying the cost to connection of the digital health and rights project, with the Ghanaian context, some peculiar issues were identified. And we are talking about economic barriers. We are talking about, stigma when it comes to accessing information and all of that. Okay. So now the conversation is around what can we do? So as part of the policy brief that was designed for Ghana based on the research that was done, the recommendations are for there to be, not only should there be these systems, because whether we like it or not, digital health is here to stay. But now, how can we carry the entire populace along, taking into consideration the different barriers that we have? So we are looking at not only accessibility, that this product is there, but we are looking at affordability as well. So how can the government help with that? We are recommending, affordable data packages for, health and education content. I know some of the telecos have some targeted, data packages for business people. We can do the same for digital health.
Okay.
We can do the same for, what's it called? We can do the same for young people to be able to access all of these information. Then to address, that would actually address the economic barriers that, prevent people from accessing these services. Then we can also look at the reporting channels for, due to the stigma. Exactly. Conversations are being had around, digital health. We have key populations that live in the country. We are looking at persons living with HIV. We are looking at, persons belonging to certain marginalized communities. If there are proper reporting channels, these people should be able to do that freely. Because again, another issue that was spotted in the research that was conducted in the Ghanaian context was technology facilitated abuse.
Correct.
So technology facilitated abuse, how can we curb that? Because that is now like a major area. We used to know, gender-based violence. It used to happen offline. But now the country has moved to online. And we have somehow managed to carry the offline behavior into the online space. And the people that are at risk the most are the people that we have mentioned in our research. That is the key populations. So we need to have clear reporting channels so that people will be able to feel safe to access this information. Sometimes, yes, people have access to device. Sometimes, yes, maybe by some grace, they're able to afford data. But then again, the question they are asking themselves is, as I am looking at this platform, as I'm trying to, access information via this platform, who is receiving my data? If I have something that I do not want to disclose publicly, where does this data go and how will that data be used against me? And we already know the stigma that surrounds, you know, living with HIV. So the plan for digital health should, you know, not just be a one-sided conversation. We don't want just people to sit inside one room and decide that this is how the digital health landscape is supposed to go. We want every voice at the table.
Okay.
Not just certain voices, not just because, Martin lives in Accra, so we can easily invite Martin to the meeting. But Rahel, I live in Tamale. And the experiences of young people or key populations living in Tamale are not the same as the ones living in Accra.
Yeah.
So we need every voice in the room. You will say, oh, we brought young people into the room. We have young people here with us. But which kind of young people? Because we have young people, young persons living with HIV. We have young persons living with disability.
Yeah.
All of these are also a different demographic of young people. And even though our struggles as young people may be linked, but there's definitely going to be some differences. Yeah. So when we are designing all of these things, we need to be deliberate about inclusion.
Yeah.
Be deliberate about having every voice in the room.
Yeah.
Be deliberate about taking into account everybody in the design stage, and we need to be deliberate about how the end user will be able to use this. So sometimes availability is not accessibility.
Yeah.
So
Rachel, I'll come to you. You've really gotten to my way for a question. I want to ask you. So let's listen to Martin and Solomon. Then come to Rachel for your last words.
So for me, I will end by saying that there should be a scenarios of trainings.
Okay.
Okay, most of the times, these digital health training are so rigid.
Yeah.
And sometimes people can't really get the understanding of it. And the language too also should be tailored in a way that people would understand.
Yeah.
Because I live in Accra, maybe I might understand English, Ga, and maybe Tree or something like that. Someone might be living in Tamale. Have a different language. Takra, they have a different language. So these things should be taken into consideration. And also with the community-led, the government should partner with funds, people who provide funds, and also help with community groups so that they will educate them, and also for them to also go out there and spread their information and advocate for digital health and rights. Yeah.
Yes, so just like they mentioned, first of all, there's the need to make data very affordable so that everyone can have access. And like Rahel rightly said, I mean, we have to be very deliberate in terms of our inclusion policies. And then again, platforms should be multilingual, various languages, so that there will not be any language barrier. Everybody can access information in whatever language that is convenient to them. And also, like she mentioned, youth digital empowerment was one issue that came up, I mean, amongst the youth during the research. So the youths have been calling for digital empowerment, so that will be able to address the issue of literacy, digital literacy. And then our reporting systems should be strengthened. Like I always say, the kind of designs affect implementation. So if the reporting systems are not robust, they are not strengthened, then definitely there will be issues with implementation. And we will come back, I mean, having the same conversations again. Thank you.
Thank you, Solomon, for that. And it has been such an insightful conversation. And from the conversation so far, it's clear that while Ghana is still making strong progress digitally, we still have work to do to ensure no one is left behind. Thank you.